Hello, and welcome to today's Pedestrian and Bicycle Information Center and American Public Health Association webinar series. Today's webinar is titled, Communities Putting Prevention to Work, Using Walking and Bicycling as Ways to Promote Public Health. And we will be speaking with Paul Hunting, Public Health Advisor in the Division of Community Health at the Centers for Disease Control and Prevention, Mary Baloff, Chief of Health and Nutrition Community Services within the Douglas County Health Department in Nebraska, Carrie Peterson, Executive Director of LiveWell Omaha, and Elisa Haushalter, the Project Director for National Communities Putting Prevention to Work campaign. My name is James Gallagher, and I am the PBIC Communications Manager. I'll be facilitating today's webinar. I'd first like to say hello to today's speakers to make sure that they are ready and that everyone can hear them. Paul, are you there?
Yes, I am.
And Mary, Carrie, and Elisa, do we have you on the lines as well?
Yes, good afternoon.
Mary and Carrie are here. Thank you.
Attendees, if you can hear me and if you can hear our speakers, please click the hand in the box in the upper right corner of your screen to raise your hand. This is so we can be sure that you can hear us. Great, I'm seeing lots of hands. Before we get started with today's webinar, I want to go over a few administrative details and the functionality of the webinar software. If for some reason your computer or web browser freezes during the webinar, please reload the website and log back into the program. You will be able to rejoin the session. Please note that attendees will not be able to speak during the webinar. We do expect a large number of attendees, so by muting your audio, it helps us to cut down on confusion and background noise. As an attendee, you have a control box in the upper right corner of your screen that collapses and expands by clicking the double arrows. Though you won't be able to speak, you will have the ability to ask questions by entering them into the question box. If you have a problem during the webinar, you may enter it here. I'll monitor these questions and respond to you if I am able. Questions pertaining to the presentation may be asked at any time in the question box, but they will not be addressed until the end of the program, when we have built in about 20 minutes for a discussion period. Please feel free to ask those questions as we go along, and we'll get to them after the presentation. Also, when you exit the webinar, there is a very brief survey that will pop up. We would very much appreciate your feedback on our performance. Within 1 to 2 days following today's webinar, you will receive a follow-up email from GoToMeeting. Please do not delete this email. This email will include a link to download a printable certificate of attendance for 1.5 hours of instruction. If there are multiple attendees at your site, please forward this link to the other participants so that they can download and print the certificate with their names. This webinar has been approved by the AICP for 1.5 CM credits. The Road Safety Academy, the training and education arm of UNC Highway Safety Research Center, is a registered provider of CM credits. For more information on the Road Safety Academy, please visit www.rsa.unc.edu. Finally, this is the second of 3 webinars being presented jointly by the Pedestrian and Bicycle Information Center and the American Public Health Association that explore safety and health. On November 13th, we will be putting on a webinar on the Prescription Trails program. Please check back for more details on that webinar. For more information on those webinars, as well as others, or to view the archives from this webinar series or others, please visit www.walkinginfo.org/webinars. Before I turn the screen over to Paul, I want to take a quick poll of the audience. I'd like to welcome and thank Paul, Mary, Carrie, and Elisa for their presentation today. We'll take questions at the end. Paul, I'm going to pass the screen over to you now.
Thank you. Well, good morning or afternoon. I understand there's quite a number of us on the phone, and understandably, we're calling from various parts of the country. So, whichever applies. Good morning, good afternoon. My name is Paul Hunting, acting team leader for the Communities Putting Prevention to Work at the Centers for Disease Control and Prevention in the National Center for Chronic Disease and Public Health Promotion. I'd like to thank the American Public Health Association and the Pedestrian and Bicycle Information Center for hosting today's webinar. This is a vitally important topic, and I appreciate their leadership in driving public health to consider the impact of the built environment on the health of people, as well as our opportunity to have an impact on the built environment. Let's begin by discussing the growing health challenge in the United States. These challenges come in part from rapid changes in our society, including economic and technological progress, having compounded the drivers of chronic disease and helped us to engineer healthy living out of our daily lives. As an example, sedentary screen time is on the rise for all ages. Labor-saving devices, such as dishwashers, have taken us away from hand-washing dishes to using the more sedentary dishwasher. Portion explosion, restaurant and fast food availability on every corner, unwalkable communities and urbanization, and less PE in schools have all contributed to this issue. Our unhealthy environments have caused the chronic disease burden to grow at a breakneck pace, and the impact that it has on all aspects of our lives, not just individual health, is enormous. You may already know some of these statistics, but they bear repeating. More than half of American adults have at least one chronic illness. Chronic diseases lead to lost productivity, reduced quality of life, and premature death. And indeed, 7 out of 10 deaths in the United States are caused by chronic diseases, and over 2 million heart attacks and strokes occur annually. Additionally, there continue to be large gaps in clinical preventive services. 1 in 3 Americans has high blood pressure, a significant risk factor for heart attacks and strokes, yet only less than half have it adequately controlled. This means that roughly 75% of the money spent nationally on healthcare is focused on chronic diseases. Our mission at the Division of Community Health is to curtail these trends by supporting communities as they develop and implement initiatives to reduce costly chronic diseases and associated risk factors that lead to death and disability. Built environments have been part of the challenge and will be part of the solution. Let's discuss the relationship between the built environment and community health. Healthy community design can improve people's health by increasing physical activity, reducing injury, increasing access to healthy foods, improving air and water quality, minimizing the effects of climate change, decreasing mental health stressors, strengthening the social fabric of a community, and providing fair access to livelihood, education, and resources. These healthy communities also have an economic impact, a healthier, more productive workforce, fewer hours wasted in the car, and greater attractiveness of businesses. Healthy communities play an immeasurable role in health and quality of life. Unfortunately, as I mentioned earlier, for as much as they have the potential to be a source for good, we're increasingly seeing them support unhealthy lifestyles. We've seen some dramatic changes in our environment in the past decade, each with an impact on both physical and social health. Here are a few numbers describing the challenge. From 1972 to 97, the number of fast food restaurants doubled, and the number of restaurants rose by 35%. Evidence indicates that a 10% increase in the number of fast food restaurants increases the number of overweight people by 4% and the number of obese people by 7%. There has been a 236% increase in time spent in traffic since 1992, and each additional hour spent in the car is associated with a 6% increase in the likelihood of obesity. For social capital, the mean commute time in 1980 was 22 minutes, and the mean commute time just a few years ago was 25 minutes. This may not seem like much, but the increase can be dramatic. Each additional 10 minutes in daily commuting time cuts involvement in community fairs by 10%, which impacts our social capital. For special populations, the impact of built environments is of particular concern, especially for those people living in low-income neighborhoods in rural communities. Low-income, underserved communities have limited access to healthy foods and recreational facilities, and rural communities have a high number of convenience stores. Just 1 in 5 children in the United States live within a half mile of a park or playground, and the availability of safe places to play looms far worse in low-income neighborhoods. Strategies to improve our environments focus on replacing barriers to a healthy lifestyle with supports for healthy and active living. They include encouraging mixed land use and greater land density to shorten distances between homes, workplaces, schools, and recreation. They include providing good mass transit to reduce the dependence upon automobiles, to build good pedestrian and bicycle infrastructure that's sustainable over time, ensure affordable housing is available for people of all income levels, create community centers where people can gather and mingle as part of their daily activities, offer access to green spaces and parks, and create outlets for fresh fruits and vegetables, such as community gardens and farmers markets, and especially those that accept EBT. In the latter portion of this webinar, you'll hear two great examples of work to create healthier communities as part of our CPPW program. These are just two of the 46 CPPW communities funded to combat obesity through the implementation of evidence-based strategies that support improved nutrition and a built environment that is conducive to biking, walking, and other forms of physical activity. I'd like to provide just a brief snapshot of some of the programs that have been spawned from CPPW called Community Transformation Grants, which is our new major initiative. Community Transformation Grants is our newest program focused on improving built environments. CTGs specifically utilize the following 5 strategic directions to achieve success in our 5 core priority areas of tobacco-free living, active living and healthy eating, high-impact quality clinical and other preventive services with an emphasis on controlling high blood pressure and cholesterol, social and emotional wellness, and healthy and safe physical environments. Among these areas, our awardees are required to work in the first 3. Built environments are focused on the majority of our awards. 69% of awardees are addressing comprehensive approaches to community design to specifically encourage walking, biking, and/or other active transportation. To provide some details, 60% are working in the area of urban design, land use and zoning, 9% to improve access to public transportation, 40% promoting walking or biking to and from school, 31% on protocols to assess the impact of community changes on community health and well-being, and 47% to enhance infrastructure for physical activity, including paving existing bike paths, installing signs, and other activities. Thank you for your time for this brief moment. I'd now like to turn the call over to Mary Balev to share some of the fantastic work that's being done in Douglas County. Mary, I'm going to transfer it over to you.
Thanks very much, Paul. Carrie Peterson is going to start us off. We're going to tell you a little bit about the story of walking and biking in Omaha and our experience through over the last few years, and particularly our experience with communities putting prevention to work. Carrie?
Thanks, Mary. First of all, thank you for this opportunity to tell you a little bit about our story. I think that Douglas County is unique in that we have an extremely strong partnership with our public health department. I represent Live Well Omaha, which is a healthy community initiative. We've been around since 1995 and have over 57 different partners around the table that all are working collectively to improve the health of the community. And we couldn't do it or be as successful as we are. Did our slides showing? I don't mean to.
Yes, they are.
Okay, perfect. Our screen over here just went blank, so I just wanted to confirm that we've had great successes because of this partnership. So to talk a little bit about what we have done here in Omaha. Omaha is not immune from the national trends around obesity and overweight that Paul referred to. In 2002, with assistance from the Douglas County Health Department, Live Well Omaha issued a report card on health, and in it we saw the trends of obesity and overweight and how it impacted almost every area in our community. Fortunately for us, at the time, Robert Wood Johnson launched its grant application for Active Living by Design. We are one of the communities that applied for it, and were fortunate enough to get the grant. Our application in it was really around a campaign to let Omahans know that in order to reverse these trends, they needed to get out and active anywhere, anytime. We really felt like we had good infrastructure in Omaha and Douglas County, and that we just needed to get the message out. Robert Wood Johnson also encouraged all its grantees to follow what they called the 5P model. And in that, in order to be successful, you had to have a strong partnership, you had to have promotion activities, you had to have programming activities, looking at the physical infrastructure, and then policy change, and that's the model we embarked on. Our first efforts were around creating this campaign around billboards, signage, to let Omahans know that we had a great city. We just need to get out and active. You don't have to join a gym, but take your family out to the parks, play, use our trail system, walk at lunch, etc. And we embarked on a fairly rigorous campaign to do that. Under that auspice, we developed or branded this effort called Activate Omaha, which sat under the umbrella of Live Well Omaha. This is just an example of some of the different creative, again, very simple messages, but very clear about getting out and getting active. The second component was focusing on a partnership. So we already had Live Well Omaha as a backbone organization, but we also looked at developing groups that were specific to biking in particular. We hadn't had a lot of work in our community around bicycle activities, and we formulated Omaha Bikes. And I don't expect you by any means to pay attention to any of the detail on this slide, but just to show you that we were developing infrastructure and really focusing on bringing non-traditional partners to our table. We also looked at some programming efforts. We put a grant application into our state Health and Human Services for about $15,000 to purchase a fleet of 25 bicycles. And with that fleet, we partnered with our local Boys and Girls Club, Girls Inc., to provide opportunities to take the youth out onto our trail systems, to teach them bike safety, to have them look at the different infrastructure, connectivity, how to be a good steward of the trail system. And that actually, we applied for that funding back in 2005, and the bikes are still in use. And we found that some of our youth hadn't even been on a bicycle before, much less experienced our trail systems, which Omaha has about 100 miles of great trail, recreational trail that runs north and south. The program is running strong. It takes very little effort and or funding to implement the programming. Another group or another programming effort that we had that was really instrumental is we partnered with a local bicycle trek shop to launch what we call the Bicycle Commuter Challenge. Omaha is very strong in its corporate efforts, and we wanted to partner with businesses to get the corporations to encourage their employees to bike to work at least once a week over a 4-month period. So it wasn't just the one day, ride your bike to work, but rather we wanted to try to incorporate that behavior into people's lifestyles. My favorite quote was from one of our board members who worked in an insurance company, and he said, "This is wellness on the cheap, because you encourage your employees to get their physical activity before and after work, and they come to work being a more productive employee." Our first year we had 127 riders, and after a little evaluation, we got a lot of pushback. People told us that it wasn't safe, that in fact the infrastructure that we thought we had to support active lifestyles wasn't there, and we only had 1 mile of bicycle lane. We also, at that time, applied to the League of American Bicyclists to become a bicycle-friendly community, and as you can see, we were denied, which was a major setback for us. And it was our wake-up call to realize that we really did have to look at our infrastructure and look at policy and the way that we do business here in Omaha. We visited our city, our planning and public works, and they told us essentially that their job was to move automobiles, not to move bicycles. So we knew that we had a lot of work to do. We regrouped under our partnership and decided that we needed to bring some resources to the table and to partner with public and planning so that they could help share the vision which we held. We were able to get 2 grants that were very significant in helping to change our infrastructure. One was about $600,000 from 2 private foundations here in Omaha to start putting the first infrastructure in our community to take us from 1 mile to bicycle lanes to hopefully 40, and we're about 20 miles into that. And we wanted to have very consistent signage, and that's what you're seeing on the screen right now. The fever caught just a little bit, and our local metro, unbeknownst to us, actually installed through another grant bicycle racks on every bus in our metro area. And what's really neat about this, there were some non-believers, if you will, in the beginning, but the utilization rate of those bicycle racks has just continued to increase every year, which we are really excited about. Here's just an example or diagram of that network. The other piece that we did is we applied for another grant to develop the first bicycle map for Omaha, so that when we went the next year to those companies to tell them how to encourage their employees, we also provided them with a bicycle map. If you're going to ride your bike and you live on Woolworth or Leavenworth, here's the best route and the safest route in order to get yourself to work. So we really started to try to develop that infrastructure and the supports to allow people to do it safely. The other area that we started to move in was policy. I think this is one of the neatest examples of the non-traditional partners coming to the table. Our local health, one of our local and largest health system, Allegiant Health here in Omaha, board a few years ago decided to focus on childhood obesity. And one of the links that we made together was the need for somebody within city and public works to be the voice for bicyclists and pedestrians on an ongoing basis, and put up the funding for a 3-year period to hire a balanced transportation coordinator within the city, so that we constantly have eyes in the city bringing the message of multimodal transportation. Since all these efforts, and there's a lot more, unfortunately, that we don't have time for, we reapplied to the League of American Bicyclists and received bronze status as a bicycle-friendly city. As I said, we have 20 miles of bicycle lane on the ground with 40 more by the time we are done and over. So we really have, in a very short amount of time, been able to move ourselves from that original 1 mile of bicycle lane, and we've done it, and we only could have done it through the public-private partnerships of which we have fostered along the way. And I'll have Mary talk to you a little bit more about how those efforts have expanded.
Thank you, Carrie. What we wanted to share with you is the specifics that we were able to put together through the communities putting prevention to work. And what you can see here is that Douglas County and Live Well Omaha developed a logo that we use for all of the projects that we had through communities putting prevention to work. And this logo shows our partnership. And all of the projects are called Douglas County Putting Prevention to Work. The advantage of the Putting Prevention to Work money really was that it gave us that impetus of funds that we needed to really take a quantum leap. Carrie has told you about the wonderful programs that we've done over the last 10 years that have really made a significant difference in our community. And over the last 2 years, we were really able to focus and use those funds to take, I would say, a quantum leap in our progress with bikes and pedestrians. So let me tell you about, we had 9 projects across, or initiatives across our communities putting prevention to work. I'm only going to talk about 4 of them because they really are associated with the pedestrian and the biking component of our community. Of those projects, we had, across those 9 projects, we had 19 partners. In these 4 projects, we had we had 6 partners who participated in these projects. The first of which is the Safe Routes to School program that Carrie's talked a little bit about previously. We have had this program in our community for about 6 years. And this gave us an opportunity to really go from 1 school at a time to moving up to 16 different schools in which we actually were able to initiate Safe Routes to School programs. And what you can see is those programs helped us create the connectivity not just to from home to school, but between schools and libraries, between schools and recreation centers. It was a way to really improve how children could use their own bikes to get around in this particular community. You might ask how we did it. This is an example of one of the ways that we looked at it. For each school, we developed maps that showed how you could safely get from your home, either walking or biking, from your home to school, and decided what those active routes would be. And those routes were then, these maps were shared with each of the schools. There's one for each of the schools. And throughout that process, we developed 60 different routes that affected 9,500 children. A second component that we looked at was the transportation element of the master plan. As Carrie told you, we are a community that was really car-centric or focused on our cars. In this particular effort, we worked with the planning department of our own community to try to look at, it had been nearly 15 years since the transportation element of the master plan had been updated. And so what we wanted to do was try to figure out how we could develop this element, the transportation element, to really look at people having choice about the kind of transportation they wanted, how they could walk or bike or take public transportation. So underlying this was the component of complete streets, and it really was to give people the choice about how they were getting there. Just to show you a little bit about how we implemented this plan, this was this is the plan from beginning to end and the time frame that we looked at, from inventory to a visioning process to an assessment process to recommendations. And we're proud to announce that that plan actually passed on August 22nd in our community, and it really will be a major change in our community in terms of how we look at transportation in the future. And it now has criterion within that plan that will help to select biking and walking initiatives as part of the funding sources. The third part of our component was an educational component called iRide. In this component, we tried to help people understand, no matter where you are in terms of your biking experience, if you haven't biked for 10 years or if you bike every day, to try to think about going one step further. And also to help both bikes and motorists to think about who's on that bike and how are they getting around our community. We had over 500 people come to events that were specific bike events that occurred within our city, just helping people think about biking. For some of us who hadn't biked in years, it was a great opportunity to dust off your bike and take it in and have someone help you look at it and see what needed to be done with it. And we had a campaign. You can see this is one of the 4 posters that were, we did posters and we did billboards and we did some bus wraps, and there were also some other media components. But through all of those sources, we had over 5 million impressions of the concepts of iRide. So we feel that was very successful. Another component of this was the campus cycling. When we started out, we have 3 college campuses in our community. And each of those campuses were, to some degree or another, bike-friendly, but not all of them had really great resources. So we worked with each college campus to put in place some sort of bike library. In one campus, it was a bike share program. This is the Metro Community College, and you can see their green bikes that were placed there. In another college campus, we have Creighton. What they decided to do was actually develop a storage place for students who brought their bikes to campus. We do have winter here, and so during the winter months, there might be times when students wanted to store those bikes, so they developed that. Each college campus looked at what they could do, but each of them added more bike racks to their to their campuses, and we have over 376 new bike parking places based on this program alone. Lastly, I want to tell you a little bit about how we have used the Communities Putting Prevention to Work to really build our own capacity within the health department. At the time, about halfway through the Communities Putting Prevention to Work grant, the department saw the impact that we could get from this, and so we applied for one of the CDC's health impact assessments. And so we were awarded one of those, and each year now, for the next 3 years, we will do 3 health impact assessments. One of them will have to do with transportation. This is just a diagram showing you the current one that we're working on, which is to look at a road diet in one of our busiest streets in one of our ethnic communities. So really helping to understand what the benefit would be, bringing together community members, the planning department, policymakers, and other influential or key stakeholders to really talk through what this health impact could do for us. Lastly, I'm going to start this off and let Carrie finish this. One of our things that began in CPPW but has grown way beyond CPPW is something called the V-Cycle program. Carrie, do you want to tell us a little bit about it?
Sure. V-Cycle, some of you probably have these in your community, but it's a concept of having a bicycle sharing program within your community that will try to encourage trips of less than 2 miles to be taken on a bicycle rather than people getting in and driving their car. This, again, was another example of how dollars were leveraged, and our local Blue Cross and Blue Shield of Nebraska invested in this initial pilot program in one of our areas of town called Exarban. And in our first year, we had 35 bikes across 5 different stations in this area. And in our first year alone, we had over 850 memberships that were sold. Total number of trips was 2,389. Total calories burned, 606,000. And then obviously the total carbon. This exceeded our expectations so much so that we're actually looking at about a $2.2 million expansion right now across the city. And what's really exciting about this is at this expansion meeting, the CEO of Blue Cross and Blue Shield started talking about it as a transportation system. Again, understanding the impact of getting people outside of their cars for those trips that are less than 2 miles long. The other co-chair of that meeting was our president of our local Chamber of Commerce, David Brown, who understood the economics of having a healthier city and from a recruitability and just an overall appeal in our city. So this message of public health, in many ways, bikes has taken it out of the traditional realm that it's gone beyond, as Marianne and I like to say, beyond spandex in our community to kind of catch on. And we're really excited about the opportunity of V-Cycle to really impact people in the health realm without them really knowing it. Thank you so much.
We're now going to give the program over to Alicia. At least I hope that's what we're going to do. So,
And I'll go ahead and get started. First, I want to thank you for the opportunity to share a little bit about Nashville, and particularly Nashville's Communities Putting Prevention to Work campaign. I also want to acknowledge that although I have an opportunity to present the work of our team and to represent our city, all of the work that we've been able to accomplish prior to CPPW and through CPPW is really representative of many collaborations, partnerships, and exceptionally strong leadership within our city, and I want to acknowledge that by this slide. By the end of our time together today, you should have a little bit better understanding of Nashville. I think the context and how we were able to utilize CPPW within our community is important. Then also a little bit about our CPPW campaign overall, but specifically our focus on both walking and biking and how we were able to have specific initiatives through CPPW. A little bit about Nashville. We are considered a metropolitan community, so we have a combined city-county government. We have a population that's slightly over 600,000. One of the critical components is that we are considered both urban and rural, and that's important to think about as we promote both walking and biking. And I like to say that Nashville is a big town with a small city feel. The other thing that's critical is we're considered the healthcare capital of the United States because of the number of businesses here that healthcare is their primary industry. Also, Nashville has a very strong history of collaboration, much like Omaha. Our collaborative efforts date back to 1995 when we had our first Healthy Nashville effort. But over the decade of time, what we've had happen is many more partnerships have been built. Many are in the community. They're not necessarily within the health department. The health department may be a partner, but not necessarily the leader. But then over time, there's been more of a focus on walking and biking. So we already have a Bicycle Pedestrian Advisory Council. We already have a Walk Bike Coalition. We had another previous coalition that joined with the Walk Bike Coalition. So we have quite a bit going on in this area already. And we have a strong history of political leadership with the focus on creating a healthier Nashville for all people. And we also have a history of community-based participatory research that includes both our health department as well as our partnerships with academic institutions. The thing that we like to say in regards to communities putting prevention together was really an alignment of the stars, so to speak. There was a convergence of many things in a moment of time that allowed us to take significant leaps forward in building both infrastructure, establishing policy, systems, and environmental changes within our community. So there were many converging recommendations around the beginning of CPPW, we'll say 2008 to 2010. Those were within our community. There was a Green Ribbon Committee, a Nashville Livability Project, as well as Nashville's Agenda, and many of those were in alignment with national recommendations to improve walkability of communities and also to improve different types of transportation and to improve biking within a community. In addition to that, many of our coalitions, councils, and committees were developing very similar recommendations, again with a high focus on walkability. The critical nature of this was that it allowed us to begin to leverage significantly as we moved into our CPPW campaign. Additionally, we hosted our first Nashville Heals, which was a Healthy Eating, Active Living Summit in 2009, which brought many of the previous players that were identified on the slides into one room to talk about what the city could do next, collectively and leveraging resources to create a healthier community for all. There was also a convergence within metro government where many departments were beginning to talk about health and their role in influencing health outcomes. That was within metro parks, public works, as they were having more resources allocated for the development of bike lanes and signage, as well as Nashville MTA as they were increasing bike routes as well. In addition to that, we saw this alignment between local interest and national interest, which created a moment in time that had not existed previously when CPPW was announced. I like to show the picture of the Emerald City to essentially say we were striving for something that was bold and revolutionary to move, as was mentioned earlier, quantum leaps forward in a 2-year period, and to be able to focus on creation of healthy places so that we will have healthy people. We were one of the original 44 communities that were funded. We took much of the language around CPPW very seriously into heart. So we knew this was a one-time, 2-year, very intensive campaign. We also knew it was a once-in-a-lifetime opportunity to strive for something that we had not been able to achieve before due to limited resources. This slide represents something that happened in the midst of everything that we did not anticipate in Nashville. We had a flood. It was a historic flood. It really impacted our city greatly, but as a result of that, there also was the development of a flood recovery plan, which allowed for the purchase of additional land to extremely expand our greenway system and our bikeway system. So something that was viewed as a very strong impact negatively on our community actually allowed us to leverage a new opportunity as well. Some of the CPPW bricks that allowed us to continue to move forward, again, we took very seriously. So that was jobs creation. I also want to highlight equity. I'll talk a little bit more about equity as I talk about specific projects. We also wanted to focus on place and obviously programs, not programs, but policy, systems, and environmental changes. We did utilize the MAPS strategies, media, access, pricing, point of purchase, and social support. with the overlay, again, of equity and safety, and there will be, I'll talk more about that shortly. The other is we really wanted to focus on changing the context in which decisions are made. So again, a focus on environmental and infrastructure changes. I want to spend a little bit of time on how we developed our community action plan. As I said, Nashville has a long history of collaborative efforts, so we were able to convene a significant number of people in a short period of time, over several weeks prior to the development of our community action plan. There's a listing here. We had 5 community meetings. We met with 19 different organizations, many of them that then had connections to community and other partners, and then individual leaders within the community. We also met with political leadership, and then we had one-on-one meetings with some individuals to dig a little bit deeper. The reason I think this is so critical is we asked many questions, but we asked one significant question, which was, given that there's a 2-year period of time that will not occur again, what is it that we can do at this moment in time that will be bold and revolutionary, that will be our legacy to this community to create opportunities for people to live healthier lives? And it was amazing how quickly people came up with a list of what was needed next, and that's what led into our community action plan. We really focused on how decisions were made across the city, but I would also say we focused on the why of decisions, the beginning discussion of health in all policies, or policies that influence health for all. And CPPW, created an opportunity for us to have that discussion that we could not have previously, or did not have previously. We did see this as a movement, and the ability to focus on places where people live, learn, work, play, and worship. We did not focus on obesity per se. We focused on healthy eating and active living. We did not focus on programs, although there are a significant number of programs already in existence. We wanted to support those, leverage those, and make them more sustainable, but obviously focus on PSE. And we wanted to have an attitude that this did not start and end with government. We were an equal party at the table, but obviously we had an opportunity with additional funding to do something different than we could have done previously. I want to talk a little bit more about our specific walking and biking initiatives, and I will mention again, none of this can happen without many partners in the community. We had an overarching media campaign. One of the things that we knew is that with so many previous initiatives, it was important to be able to honor all the previous work and to try to capture all of that, not just CPPW. So we did we hired a PR firm. We worked with community members and partners to develop a media campaign. Our brand was Nash Vitality. Nash Vitality is the spirit of a healthy, active, and green city. And everything we did built around that central theme. There was also a focus on leadership, that anyone at any level could become active in the movement. And so you see 2 examples of ads here. Some additional ads here. I tried to focus primarily on ads that promoted active living. There's 1 or 2 of healthy eating in here as well. But I think what you'll see is that we had billboards. We also had some bus wraparounds, which you heard earlier. We also used some of this in advertising on the web, as well as television ads, radio ads, and bus bench ads. This is an example of actually our Director of Health. So we tried to use only Nashvillians to represent the spirit of a healthy, active, and green community. This is our mayor. I'm going to talk more about leadership shortly. This is an ad that was used to promote the Walk 100 campaign that Mayor Dean led. Then we'll talk a little bit more about leadership. We have had exceptional leadership through the mayor's office. The mayor has really used the political bully pulpit to talk about the importance of being active, and he has also led several what we have called challenges to encourage people to get out with him. So he's building a lot of social support for people to become engaged and active. Additionally, we heard in our early conversations with community, we heard what Omaha did. Nashville has a lot of amenities already, but people weren't necessarily accessing them. So Mayor Dean made sure that he walked in all the different communities, all the different greenways, and really amenities that already existed through the Walk 100, through the 5K. And then he has just recently launched a workplace challenge where he's challenging workplaces to become healthy, active, and green through policy change and some programming. In addition to that, Mayor Dean did sign a Complete Streets executive order. We also have a bike share. Our bike share has two components. One is what we call Nashville Green Bikes. We were fortunate to receive a donation from Regions Bank. Although their bikes are green, the reason that it's called Nashville Green Bikes is that the focus is primarily to have access on the greenways. So people can utilize our existing greenways and our greenways that are under construction. People are able to sign these bikes out, become a member, sign them out, and use these bikes at no charge. We have purposely allocated the bikes. We have about 125 total to all communities throughout Nashville, so that there's this focus on equity, a desire to ensure that all people have access. In addition to that, we are launching B-Cycle here in Nashville as well. We anticipate that our bikes will be on the street sometime around November or December of this year. To drive people or to encourage people to access existing amenities, we also focused on wayfinding, and there are several different projects within our wayfinding initiatives. We worked with a design company, Informing Design, to develop some walking and destination-focused signage. There was already signage planned for the downtown city core, so we took signage to the outer levels of that, or outer perimeter of that, into what we would consider East Nashville and North Nashville, encouraging people to see historic sites, to walk towards healthy places, and there's an example of that on this particular slide. And then below is an example of the signage that is in the downtown area currently. In addition to that, we are also working with Metro Parks to do wayfinding signs within the park system, to have some newer signage and also to have consistent signage so that people can access the greenways and be directed towards our greenways. We also have developed wayfinding maps in partnership with the community and other metro departments. One is called the Groove Map. This is a map that can be used for biking. It allows people to go around those really busy streets to a more safe route. It covers all of the downtown area out to the greenways as well. We've worked with the park system to remap all the greenways and trailways, which include the bikeways as well. Then we have a Nash Vitality map, which is an online map where individuals can look for healthy places to travel to by foot, by bus, or by biking. And then both the Groove Map and the Greenways maps will be available online as well. And the mayor's office is currently leading a project for a mobile app that will allow people to access the maps via their handheld device. We conducted 2 health impact assessments. I'll focus on one. We did an assessment of our current, what's called Easy Ride. So Easy Ride is a benefit that's offered by employers to employees where they can utilize the bus system as a benefit of their employment. We did a health impact assessment of metro government, Vanderbilt University, as well as state government, which is housed here in Nashville, to look specifically at the benefits to employees who use Easy Ride with a focus on the health benefits. And what we were able to determine is that individuals who had access to this benefit were more likely to be physically active and more likely to walk or meet minimum or expected requirements for physical activity per week. We were able to utilize that then to promote to other businesses to offer this as a benefit to their employees. We have a large workplace focus. I'm only going to spend a little bit of time on that, but just to say that we have worked with the 10 largest employers to encourage them to adopt policies that promote active transportation and physical activity within the workplace. We, as a CPPW community, had a little different focus on safety, so I think it's important to point this out. One of the barriers to being active in a community is perceived safety concerns. In some of our inner city neighborhoods, one of the concerns was loose and stray dogs. So we were able to build on a partnership with the Nashville Humane Association and the United Partnership for Animal Welfare to focus on 2 zip codes that had the largest number of dogs running at large. These would be large, vicious dogs. And we did several things. We did a media campaign that focused on responsible pet ownership. We did some door-to-door canvassing and feedback and input on not only responsible pet ownership, but encouraging people to access benefits that were available to them. Those benefits were brought to the community. Nashville Humane was able to seek another grant that covered free spay and neuter for individuals that met income criteria, and then United Partnership for Animal Welfare was able to provide volunteers to assist as well. We are in our evaluation phase to see at this point if the reports of dogs running at large have gone down. Our initial evaluation showed that there was a decrease in reported incidents after the intervention. We also focused on what's called Adopt-A-Meter. So in the downtown core, there is a large plethora of new housing, but one of the barriers to walking in the downtown core is that we do have panhandling that can be a concern to individuals who either want to walk either to work or destinations or bike. Adopt-A-Meter encourages people to place money in the meter rather than to give the money to the panhandler, and then that money is used to assist people out of homelessness. We supported 2 meters as well as provided additional media support to get the message out about Adopt-A-Meter. We also launched a Moving in Harmony campaign. The desire here was to obviously make people aware of the importance of sharing the road, and we have print ads, radio ads, and video ads that build on our Music City theme. And so the focus is walking in harmony, cycling in harmony, driving in harmony, and then there's also a focus on rules of the road. This is just an example of one of the ads. This also shows Nashvillians, so as much as has been feasible, we've used only Nashvillians in our ads. And then last, we have stayed focused on our desire to work together to create healthier conditions for all. I also want to encourage people to visit www.nashvitality.org. All of our ads are available there. You can also connect with us on social media, either through Twitter or Facebook. And then last but not least, if there's additional questions, you can contact me directly. Thank you very much.
Thank you, Lisa. And now we are going to have some time for some questions. So if you have not entered your question yet, please do so. I've already gotten a few, and we'll start going through those. The first question is for Mary and Carrie. Did Omaha consider adding cycle tracks instead of road-painted bike lanes? And have you counted the gender and age of the population of bicyclists now in Omaha?
Great question. We actually have, and we are implementing a cyclo-track on one of our older street right now that's one-way Farnham Avenue, and so they're anticipating actually construction on that in the spring, so we're excited. One of the things that we looked at and we acknowledged really early on with the balanced transportation plan is that we needed to do a mix in the city, so in some cases they're road diet, some connections, or in some cases they're connections to our trail system. Some of our road, we just need to keep people off because no matter what we do, it isn't safe. So we are doing a cyclotrack, and offline I'm more than happy to send information about that. As far as the demographics of our riders, we don't have a very good feel for that. It's something that we would like to do to be able to have a baseline to see how our ridership is increasing. If I had to make a guess on it, I would say probably middle-aged men are probably the demographic. Now I don't have any data other than just visual eyesight to back that up, but I think it's probably fairly accurate.
Okay. How receptive was, oh, sorry.
The only thing that I was going to say to that is we do have some data. The challenge that I mentioned, our corporate cycle challenge, our numbers have grown to over 1,700 with that, and we do have some baseline data that we can look at for the demographics. Okay.
How receptive was the Omaha city government to your changes, and how did you handle any pushback, if any, from the community or the government?
Well, I would tell you, Carrie and I would tell you that when we started this process, we had a lot of difficulty getting city planning to, I think, maybe take us seriously. They thought it was interesting ideas, and as Carrie mentioned, their role was to move cars in this community. So I think to our surprise, we were very persistent, and I think to our surprise, when we included them in the CPPW money to actually do the update to the master plan, I think that was one of the key components when we brought in the finances to actually help to pay at least half of the salary for the bike pit coordinator. That helped. So interestingly, at one of our first, after we'd had CPPW for about 6 months, they held a public meeting that was the first public meeting for the transportation element, the change for that. And I don't think we could have paid them to better say how well public health was related to the work that they do. Carrie, do you remember the quote?
I don't, but Mary and I both looked at each other and said, you know, they have drank the Kool-Aid. They were the ones that were carrying the message, which is how we knew that we had gotten over the hill, so to speak. The other thing that I would mention with them is we have taken, facilitated and funded 2 trips, community plunges, one to Boulder, which of course we all know is kind of the mecca, Omaha, and the other one we sent them to Minneapolis. And we did in Minneapolis, we were offered the opportunity because the climate is similar, the people are similar, the landscape, and both of those, when they have actually seen other governments find funding and have seen it be very intentional in their own planning process, it went so far to get them to be the advocates and see the vision for themselves. But we didn't ever come after them adversarially. We always were in partnership. Let us help bring funds. Let us help offer political cover if you're receiving pushback, and that has gone a really long ways. Oh, and we did fund both of those community plunge trips.
Live Omaha funded those.
Following up on funding, in Omaha, is there any financial support to the implement the recently passed transportation plan? And if so, how did you leverage those funds, and from where? Was it city or state or other funding agencies?
Because the transportation element is part of the master plan, the funding for that is the community funding. What was interesting was in the update of the transportation element, part of that is what's called our let's see what's it called, the CAP, which is the Community Improvement Plan. And that community improvement plan is funded by city dollars. So much of the discussion about this particular update was to think about how they would develop this criterion about what things would be, how things would be prioritized in the future. And so, though there is no specific funding for that came from any outside source, it is how the funds will be used that are currently in the system. And the CAP, or the CIP, the improvement plan, each year has a certain amount of funding. And one of the discussions, interestingly enough, was that there would never be enough money to fund all of the projects. So by prioritizing projects and by adding these metrics that actually prioritize things that had to do with alternate transportation really was a significant change in the way that money will be spent in this community.
We also have come to the table saying if there are projects, let us help leverage the funding from outside sources if we can and if it's appropriate. And as well, our Nebraska is one of the only, I think, 2 states in the nation that still has a Department of Roads as opposed to a Department of Transportation. And so I think that there have been a lot of dollars that have been left at the table that haven't looked at multimodal transportation. And now City Planning and Public Works are starting to think about how do we request those dollars and how do we ask for things differently than we have in the past. So the funding is, we're kind of in a transition phase on that, and we're extremely optimistic that by looking at things a little bit differently, framing them differently, that we'll have more funding opportunities.
Thank you. Elisa, can you speak to the work of the MPO and the Nashville Design Center in your program?
We have a long history of working with the MPO, which is the Metropolitan Planning Organization. They fund projects that would enhance or supplement to some degree some of the things that we have funded through CPPW. So Leslie Meehan, who is with the MPO, and Michael Skipper actually gave input on the development of our community action plan. We continue to work with them. One of the things I think is critical is that the relationships are important prior to funding, and so it helps leverage opportunities when they arise if there's already a relationship. And I think that's one of the things with the MPO is that we've already had a strong working relationship with the MPO that dates back many, many years. We're currently working with them as they move forward to implement Safe Routes to School in Nashville. So that's ongoing work that we will have with them. We had included originally funding for an updated general plan very much like Omaha, but that was something that is going to be completed in the future. So what we did was develop a project with and in partnership with the Civic Design Center, which is looking at health in the built environment within the Nashville community, and it'll serve as a white paper that informs the updated general plan. In addition to that, the Civic Design Center has focused its entire strategic plan on health in the built environment. So throughout 2013, they will emphasize in all of the efforts that they do the connection between health and the built environment. They also engage in very creative projects, and so they are able to involve young people and others in the development of creative projects such as videos to advance the idea that there's a link between health and built environment. In addition to that, they'll have a photographic exhibit and several other exhibits in 2013 that build on the Healthier Nashville document that they're developing through CPPW.
Okay, great. Could one of you please talk about the specifics on how your local health authorities helped in your initiative?
This is Mary Bolliff, and I am with the Public Health Department, and so we were the recipient for the CPPW money. And if you remember, the very first grant, one of the very early grants that Carrie talked about was the grant between the for the Keystone Gateway for the bikes that we bought, and that was actually a grant that the Health Department applied for in partnership with the Live Well Omaha. So if by health authority what you're asking about is our Board of Health has been very supportive of this and has in fact helped to be the advocate for this in our community. And this public-private partnership has allowed us to bring forward not only the health department's initiatives, but also to understand the importance of having a private partner who can often do some of the negotiation with private entities.
Great. Many transportation grants have gone to land use planning to improve location efficiency. Have either Omaha or Nashville done anything on that front?
This is Elisa from Nashville. What we've been able to do is that the individual that we had that worked on the HIAs He was an urban planner, and so he was able to help provide insight and information to others as they were developing plans. So we didn't directly fund those types of initiatives, but we did help inform those. So I think we had an opportunity as the health department to have health at the table that in the past that may not have happened.
And this is Mary from Omaha. I think the other thing is when we got the Health Impact Assessment Grant, we wrote for that grant in cooperation with both our city planning department and also using our metropolitan area planning agency, which is the regional planning agency. So I think that CPPW opened some doors for us to be able to work more specifically with planners. And so as we do these health impact assessments, we have planners working alongside with us to really help us use both the planning component and the health component to help our community understand how those two things come together. As an aside, our Metropolitan Planning Agency has just received a multi-million-dollar grant to look at the transportation and land use planning for the next, it's called 2050, Heartland 2050, to look at the planning and the for the next 30 to 50 years across our community. And we have been called as a key member in that. And those kinds of things had not happened before we started all of this, before we had an interest, before health came to the table and said, we think there's a component for health, and we often can help you tell the story.
Thank you. How are your programs reaching out to the underserved or low-income communities as well as to young people?
This is Mary. I'll talk a little bit about when we started Communities Putting Prevention to Work. One of the things that we did was create some what we called impact maps that looked at where heart disease, where the density of the population, income, to try to figure out where in our community we could potentially have the greatest impact. And much of that was in our low-income community in the eastern part of our city. So one of the things that, and we brought these maps to our partnership and saying to individuals that this is great that we have this money and that we can do these projects. And we ask you to really focus these projects into the part of the community where there is more deaths from cardiovascular disease, lower income, more obesity, denser populations, which end up being our low-income community. At the same time, a couple of key partners in our initiatives were some organizations that really represented the efforts of the low-income community. So one of them is called the Empowerment Network, based in our African American community, and the other was the Center for Health Disparities, based very much in our Hispanic community. And by having those organizations be a part of the decision making, they often can create for us focus groups that will go out before we start a project. And particularly on this HIA project, one of the one that I showed about the street diet, we actually did interviews with the business areas and the business owners in that area, which are often small businesses, but we also went to the Cinco de Mayo event, which is the greatest event in our Hispanic community, and actually did a lot of intercept surveys, over 200 intercept surveys. So we often try to bring those partners in, and with the HIA we actually bring those community members to the large meetings when we look at all of the findings and before we develop recommendations. We work very hard to engage them and to also take our projects into that community. Of the 17 schools that have the Safe Routes to School in them, 12 of them, actually 14 of them, were in our low-income community.
And Safe Routes really has been one of those areas that we have tried to target to get kiddos back on bikes, making sure that they have access, having the helmet, the safety. We received a grant to install voltage, which I don't know if any of you are familiar, but they're literally on a pole. You've got a solar panel where each child, whether they walk or bike, who signs up can get a tag that hooks to their backpack or their helmet, and they write under it, and it dings, and that data is automatically recorded so that you can track how many kids, it's an incentive program essentially, that are walking and biking to school. And it's not just about that programming, but also looking, as Mary alluded to, is that connectivity. Omaha, and this is not a proud thing, that we've had a rash of shootings in our North Omaha area as of late. So safety is a real concern, and it's looking at how to partner with those communities to create those environments that are safe so that kids feel safe walking from their house to school, to the community center, to that neighborhood park. So there are a lot of eyes on the street, so that shrubs are peeled back, but we've really tried to focus on youth through our school work and safe routes.
This is Lisa. Just a few things from Nashville is that as we developed the community action plan, we wanted to ensure that we engaged all communities at that time. We have data historically that has informed our knowledge of where the highest incidence of certain diseases are, but also we kind of are aware of where shifting demographics are within our Nashville community. So we try to engage those communities in the process of developing our community action plan. And then with every initiative that we developed, we were very focused on how do we reach out, how do we ensure that we are creating opportunities for equity, how do we use things like GIS mapping to ensure that we are reaching out. And so some of the examples would be that even in the hiring process, we were able to hire a significant number of people through CPPW. We started with how do we ensure that we have a workforce that represents the communities that we serve. And we're diligent about ensuring that that workforce was diverse. Our media campaign, as I shared earlier, has people who are Nashvillians represented in all of those ads, and we ensured that we were able to identify people that were viewed as leaders within their community and have them represented in the ads. And I think there are times when we look back, there are some things we could have done better in our advertisements, but I think in general we have represented the face of the Nashville community. In addition to that, we have some of our ads have been interpreted or translated as appropriate into Spanish and Arabic, depending on where those ads were running and where the print ads were being posted. We also ensured that we reached out to media in all of the communities, particularly in the Latino community here, as well as the African American community. We also partnered closely with the African American faith community. We've had strong partnerships there previously. On our leadership team, we sought to have diversity within our leadership team so that those members could actually challenge us to make sure that we weren't overlooking some potential strategy to ensure that we were reaching out to all communities. With the bike share program, clearly the fact that those are available in the greenways at no cost was to ensure that everyone had access and that those bikes are placed in key areas throughout the city, including areas where people may not have traditionally road bikes or been viewed that they would have access to bikes in those communities. And we targeted the educational or media campaigns to those communities and have monitored usage. And if usage wasn't moving up, we then did a much deeper dive into the media campaign to try to promote use in those particular communities as well. And we were constantly seeking input from communities on how we could better adapt our messaging, how we could better promote efforts, particularly around biking and walking. And then the two safety initiatives that I mentioned, the two zip codes that there was a focus on dogs running at large, those are lower income, very diverse communities, so our safety efforts focused on reaching out to communities as well. Our focus on youth, we have leveraged some other programs that were underway, particularly with OASIS and their focus on youth and biking. And then many of our other efforts were focused within the school system and after-school programs.
Thank you. I believe it was Carrie who mentioned that you were tracking or counting students or children who rode their bikes to school. I'm curious, what other efforts are you taking to quantify the effectiveness of these programs and participation?
We have done some other things to really kind of monitor what kind of progress we're making. Julie Harris, who works for Live Well Omaha, actually has trained individuals at the schools to do school counts. And maybe, Carrie, you can be a little bit more specific about how they actually conduct those counts.
Yeah, we're trying to do some direct observation in addition to the voltage. And we're actually launching voltage this fall, which, you know, for so many reasons, you get automatic data, stuff that you can track live, which I think is going to be absolutely fantastic as well. So for getting the data and outcomes, we'll have that as well as kind of the incentive and the novelty of it for the kids. But we are doing direct observation with our safe routes so that we can try to track how many kids actually are having or utilizing active forms of transportation to get to and from school. Right now, that's about it as far as kind of tracking those measurement outcomes.
And how about you, Lisa? What might you guys be doing to track your programs, their effectiveness, the participation rates, et cetera?
With the bike share and the Green Bikes Initiative, we monitor the number of rides as well as the demographics of the individuals that are using those particular bikes. They're primarily adults. There are some teens, but not young people. Safe routes to school, so that the focus is more on the bike initiative. And then we also have a focus on our media campaign and looking at whether or not individuals are changing their behavior to some degree, both based on the media campaign, but also just becoming more aware of the amenities that are available to them as well.
This is
following up a little bit on the bike. Oh, go. I'm sorry.
Sorry, it just made me think of two other components of that. One of the things that we have formed with Live Well Omaha is a communications committee. And as Mary had said, we had 19 partners, and one of the roles that we felt we had was to be able to tell those stories and share them in the community. And so we formed a media bureau where we have, and actually we have exceeded these expectations of at least, but our goal was 5 to 10 stories each month of these best practices and sharing, so that people were seeing what was going on and that we were creating, or at least showing people that there was a movement afoot. And then we also did do pre and post tests from the media campaign. Not only did we look at awareness, which we found 143% increase in the awareness of the brand, but we also did see some behavior change that we looked at as well.
Okay, since bicycling has been a big part of this, including with the bike share, what, if anything, have you done to promote or educate the public on safe bicycling practices? Do you encourage people to use bicycle helmets with the bike share program, or is there a requirement there? How do local laws regarding bicycle helmets factor in that? And do you do anything such as youth bicycling clinics?
This is Carrie from Omaha. The helmet is a big area of controversy, if you will, that at least from my knowledge, the other bike-sharing cities haven't quite figured out. We do definitely try to encourage the use of helmets. We just haven't figured out a system at the bicycle kiosk or the V-cycle kiosk to make that work. One of the ideas that we're going to pilot with Blue Cross is for them to actually have some helmets that people or their employees could utilize if they were going to go out and use the V-cycle. We do have a series 2, or not a series, but a fleet, if you will, of LCI, trained LCI instructors that go to the schools in conjunction with bike rodeos and safe routes to do that education, in particular for our youth. We're fairly passionate about that. We also launched, with help from the CPVW dollars, a Share the Road campaign, and you saw some of our creative with that, with the iRide. Omaha is a city that is not used to seeing bicyclists on the road, and often could be fairly classified as hostile to bikers. So even now, as we get our bicycle lanes, we've probably had a dozen calls of people complaining that automobile drivers were driving in the bicycle lane, and are we doing education? So we take it very seriously, and we'll continue to share that message that we do have to share the road. Oh, and one other quick thing is we recently just passed in Nebraska a 3-foot passing law. So now drivers are required to give bicyclists that 3-foot cushion as they pass. So I think these are all things that, as a community that's not used to having bicyclists, we're going to continue to have to put the press on into the future.
This is Lisa. I would echo some of the sentiments that were expressed by Omaha. Nashville is not totally accustomed to bikes being on the road. We're moving forward, but we're not quite there yet. So we also launched a Share the Road campaign that will continue into the future after CPPW funding has ended. There have been state laws that have been passed and clarified, and we're able to share that information with the community as well. And as much as feasible, we continue to try to get the message out collectively. So it could be the health department, it could be the mayor's office, might be the MPO, but collectively we're trying to get this information to our community and continue to reinforce it in the future. We have not, through CPPW, held youth clinics, although there are other entities within the city that do provide that for youth. So it's being done in our city, but wasn't necessarily funded through CPPW. Also, very similar, helmets can be somewhat of a challenge. So we do encourage use of helmets. We do require that people follow the state law around helmet use. We do have helmets available in the greenways for the Green Bikes program. Those are actually provided through Metro Parks. There are challenges with helmets in part because you want to ensure that the helmet fits properly. You also have to ensure that the helmet has been cleaned properly between users. And so I think this is an area where many cities are trying to figure out what's the best way to ensure that helmets are available to citizens, but that we take into consideration things like fit and cleanliness. And this is an area where I think further discussion or maybe learning from each other would be of benefit.
Well, thank you very much. Unfortunately, that's all the time we have for discussion today. If we did not get to your question, I'm sorry. There were several specific questions about bike share programs. If you'd like to know more, I encourage you to go to www.bicyclinginfo.org/bikeshare. Again, that's www.bicyclinginfo.org/bikeshare. It is a PBIC website dedicated to bike share, and we have recently completed and posted our report on bike share. It's called the Bike Sharing in the United States, Guide to Implementation and Practice. If I remember correctly, I think I've messed that name up, I'm sorry. But you will be able to find it on that website. Once again, the PDF slides from today will be available on our website, www.walkinginfo.org/webinars, later today. A recording of this program and transcript will be posted in a couple of weeks. So if you need to see it again, you're welcome to reach it there. Finally, I want to remind you that there will be a very brief survey after the webinar has ended. We greatly appreciate you taking a moment to complete this. And I would like to thank our speakers, Paul Hunting, Mary Baloff, Carrie Peterson, and Elisa Haushalter for their presentations today. And thank you to all of you for attending our webinar series today. And we hope to see you again in November.